So first of all, what is pain? So according to the International Association for the Study of Pain, it's an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Specifically, acute pain increases the nervous system activity, causing increased pain in a generally time-limited period. This is most often obviously caused by some type of injury, surgery, traumatic event, or painful medical procedure. This type of pain is short-lived and should only last approximately 3 to 6 months. The pain should decrease in intensity as well as resolve and heal at the injured affected site within that time period. Primary goal of treating this type of pain is to facilitate recovery and prevent chronic post-surgical pain or chronic pain in general. Why we address postoperative pain, acute postoperative pain, because even though it's a natural phenomenon, basic science research has demonstrated that as early as 20 minutes after the onset of tissue damage causing persistent pain, neurochemical and structural changes begin to take place in the body's pain pathways. In the transition from acute to chronic pain, these changes can become hardwired into the pain switchboard. And these are located in the dorsal horn of the spinal cord and in the higher CNS centers. The net result being an increase in the frequency and intensity of pain signals transmitted to the brain. As you can see from this table, acute pain most often affects pretty much every system of a patient. From a pain perspective, we know that due to neuroplasticity, poorly treated acute pain can lead to chronic pain. Leading into what we call chronic post-surgical pain. Chronic post-surgical or post-traumatic pain is defined as chronic pain that develops or increases in intensity after a surgical procedure or a tissue injury, and this persists beyond the usual healing time of at least 3 months. Some risk factors that have been identified that increase the risk of a patient developing chronic post-surgical pain is the presence and intensity of preoperative chronic pain, also the intensity of acute postoperative pain, and also the time spent in severe pain after surgery. Another risk factor is higher consumption of postoperative analgesics, most often related to opioids. And thirdly, negative cognitive affective states, including perioperative depression, anxiety, pain catastrophizing, and post-traumatic stress symptoms will heighten their risk factors as well. And finally, there is a prevalence of about 25% with preoperative opioid use that may lead to opioid-induced hyperalgesia.